Thank you, everybody. I have long believed that the future is not just something to experience, it's something to manifest. That our fate and future is inside of us. It's decisions at the end of the day, not conditions that determine that fate and future. We're not victims of circumstance. We can make decisions to meet moments. And this is a moment we need to make tough decisions. This is a moment where we need some straight talk and we need to tell people the truth. We need to bend the curve in the state of California. And in order to do that, we need to recognize the reality. The fact is, the experience we're having on the ground throughout the state of California, the experience that's manifesting all across the United States, and for that matter, around the rest of the world, require us to adjust our thinking and to adjust our activities. In the state of California, many people are very familiar with these adjustments. A number of days ago, there were 6 Bay Area counties that led with stay-at-home orders. Now, as I speak, some 21.3 million Californians reside in a community, in a city and or county that have similar orders. A state as large as ours, a nation state, is many parts, but at the end of the day, we're one body. There's a mutuality and there's a recognition of our interdependence that requires of this moment that we direct a statewide order for people to stay at home. That directive goes into force and effect this evening, and we are confident that the people of the state of California will abide by it. They'll do the right thing. They'll meet this moment. They'll step up, as they have over the course of the last number of weeks, to protect themselves, to protect their families, and to protect the broader community in this great state in the world that we reside in. I have confidence in that. I have confidence because I've seen it every single day. We've seen it in cities large and small. People still doing essential work. People still providing essential services. People still going out to the grocery store to get food, walking their dogs, practicing social distancing, nonetheless, when they're out in the streets. People still getting their medicine. People still going about doing the kind of essential work that is required to meet this moment. The order provides for all of that, just as these other orders that have been put into place in cities large and small across the state have afforded. People will ask, well, how will you enforce? As I say, there's a social contract here. People, I think, recognize the need to do more and to meet this moment. People will self-regulate their behavior. They'll begin to adjust and adapt as they have been quite significantly. We will have social pressure that will encourage people to do the right thing. Just a nod and look saying, hey, maybe you should reconsider just being out there on the beach, being 22 strong at a park. It's time for all of us to recognize as individuals and as a community, we need to do more to meet this moment. Enforcement comes in many shapes. You have a regulatory framework, you have licensing frameworks. I don't believe that the people of California need to be told through law enforcement that it's appropriate just to home isolate, protect themselves, go about the essential patterns of life, but do so by socially distancing themselves from others and do so using your common sense. Now, why is it important that I advance this new order? It's for the following reasons. We've been doing pandemic planning in the state of California for now over a decade. Now we're moving into application, implementation, and that includes the latest technology and data collection, the ability to work with artificial intelligence to mash that data up, to really look at trend lines before they become headlines. And what we're seeing, not only on the ground, but we're seeing through the data, is this spread continues at a pace that we had anticipated in a number of our models. Let me be precise. It's a number that we have been using for the purposes of guiding our resource delivery and guiding our decision making. We estimate in the United States, we've heard this number across the rest of the world, that people, 30% of the population, as high as 70% of the population, may contract the virus. In California, we've been working with those numbers. As a nation state, 40 million strong, we've been organized around an attack rate, as we refer to it, of about 56%, that the virus will impact about 56% of us. You do the math in the state of California, that's a particularly large number. That number in and of itself shouldn't be overly alarming. The vast majority of us, the overwhelming majority of us, won't have symptoms, will be perfectly fine. But there is a subset that we're concerned about that will not be impacted by the virus, but also potentially can impact others, including impacting our capacity to deliver the high quality services, not only to meet the moment as it relates to COVID-19, but to provide for all the acute care that millions and millions of Californians depend on every single day. So we're looking at a hospitalization rate by using those numbers. And forgive me, I know sometimes these numbers get confusing, but a 56% attack rate, if you assume that R naught, which is the number of individuals that you may come in contact with that can contract the virus, if you use that formula, we believe with a 20% hospitalization rate, a little bit on the higher end, though some would argue it could be much higher, some believe it might be much lower, but 20% hospitalization rate, it's about 19,543 people that would need to be hospitalized under that scenario, above the existing capacity of our system. So that's the planning methodology we've been using. I'm being very straight with you. And these are numbers I can assure you governors, mayors, administration across the country are working with. But I think it's time to tell you what I tell my family, what I tell my wife, just as I did 2 nights ago when I told my daughter that I don't believe that this school year she'll get back into that classroom. Now, those are difficult conversations, and I know they're conversations you're having in real time and you're having with one another as I speak. And I deeply appreciate the anxiety of these difficult conversations, but we must have them. But as we work through that planning process, 19,543 beds in our system, I'm able to look at our existing capacity. Let me be specific of what our existing capacity looks like. We have 416 hospitals in the state of California. We have capacity to provide care beyond our hospital system, but within the hospital system, we have a capacity to surge the number of beds beyond the 78,000 currently staffed beds by an additional 10,207. By the way, that number changes on a daily basis, but that's today's number. So looking at the 19,500 plus individuals in our planning, looking at that surge capacity, about 10,000, we are looking at a delta, a gap that requires about 10,000 beds, 10,000 members of the community to staff those beds. And that's currently what we're up against. But here's the point. That's a planning document. If we change our behaviors, that inventory will come down. If we meet this moment, we can truly bend the curve to reduce the need to surge, to reduce the need to have to go out and begin to cobble all those assets together. Though I want you to know we are doing just that. We always plan, we always anticipate. Let me give you some proof points. Today, we just secured a very large hospital in Northern California, Seton. It's now part of our portfolio, and we're going to populate that hospital. It's an example to meet the moment. Tomorrow, we'll announce a hospital in Southern California. That's 750 beds, those 2 hospitals combined. We start to stack this, 750 here. The motels that we're currently and hotels we're currently negotiating with, we start stacking those master leases for those hotels. We're working, I had very, very positive conversations with the leaders of 2 of the finest public university systems in the world, UC and the California State University system. We're working with those systems to identify appropriate dormitories to help us with the surge. We start stacking those numbers. We're working with the federal government. I had a conversation today with Vice President Pence and President Donald Trump together on the phone, talking about our needs, in addition to my conversation today with the Secretary of Defense about these mobile medical and field units that they have committed to pledging, not just to California, but to folks all across this country. You start stacking those things, and we have, I believe, the capacity to meet this moment, but not unless we change our behaviors and do what is necessary to meet this moment. Let's bend the curve together. Let's not regret. Let's not dream of regretting. Go back, say, well, you know, we coulda, woulda, shoulda. Now when the data all points to where I think most of us know we're going. One has to be transparent. One has to be honest. It's difficult at times being the bearer of these messages. I can assure you, home isolation is not my preferred, choice. I know it's not yours, but it's a necessary one. We started with seniors 65 and over, the most vulnerable population, and will continue to overly focus on that population and those with compromised immune systems. But we now need to broaden it to all Californians. So that's the order we're putting out today. It's consistent with the leadership we've seen at the local level, including, I want to acknowledge Mayor Garcetti and others in Los Angeles and LA County that are recognizing and meeting this moment as well. In addition, I want to thank Speaker Nancy Pelosi. We had a very long conversation today, talk about meeting the moment. We're so blessed to have her leadership in California. She's very familiar to Northern Californians, certainly familiar to me as a former mayor of San Francisco. Our conversation was not only about what she has done and what is being done in the Senate as we speak, but what will be needed over the course of the next number of months as we come back, as we recover, as we will. This is not a permanent state. This is a moment in time. And we will meet this moment together. And we will look back at these kinds of decisions as pivotal decisions. If we're to be criticized at this moment, let us be criticized for taking this moment seriously. Let us be criticized for going full force and meeting this virus head on. We're doing so today in the state of California through this order, and we're doing so by continuing to build collaboration and partnership across every level of government and the private sector. Let me conclude by just making a few points to fill in that. We had today a very important conversation. It was punctuated earlier today by President Trump in his press conference with the CEO of Gilead. It's a California-based company around treatments. I want to compliment the president in his focus on treatments. It is a focus of positivity as we work to bridge towards a vaccine. It was a very encouraging conversation. It's a conversation that we can have with many other CEOs of companies, not just in the state of California, but for that matter, around the rest of this country and around the rest of the world. There are treatments in trial. Our UC system, all 5 hospitals are already actively engaged in those treatments, in the courses that are part of some of these antivirals and some of these medicines that you have all learned about today because of the president's announcement. That's very encouraging, and we want to continue to build capacity and to build partnerships. Along those lines, we are working to build capacity and partnerships to get more protective gear in the state of California. You've all been seeing headlines. Some of them we've driven by our own anxieties in that space, others by their own limitations of access and gowns and gloves, glasses, and other protective gear. Here's the good news in the state of California. I was talking to the Vice President and the President today, thanking them for the first national stockpile transfer of assets that we just received, where we received quite literally hundreds of thousands of gloves and face masks, not just N95s, but also surgical masks. We're going to be starting to get that cache of assets out into our diverse communities throughout the state of California. Many of you know we had our own cache, we had our own storage of N95 masks. We still have 10 million of those masks, and we are getting them out in real time. We started with 21 million. We have about 10 million still as we distribute those. We've distributed those first 11 to 55 counties in the state, and we'll continue to get those N95 masks out there. And we recognize that distribution can't happen fast enough. We also talked to a well-known entrepreneur today around ventilators. As many of you know that have followed our press conferences here in the state, we have 7,587 ventilators in our hospital system. We have 514 through a cache at the Department of Public Health that are being repurposed. We have an additional 200 in our EMSA cache that we are repurposing, and then we ordered an additional 200. But we're going to need to increase the manufacturing of those ventilators, and we are working with the private sector and well-known entrepreneurs to consider to help us in that respect as well, starting to repurpose some of the manufacturing in the state to meet the moment, particularly to prepare for our seniors and others that may need that support. So again, this is a difficult moment, and this is one that I know is filled with deep anxiety as a father, as a husband, as a parent of 4 young kids, to families in particular, to folks that have had to drop their kids, no longer dropping off at school, but now are living with their kids 24/7, putting together, learning plans, trying to figure out, the nomenclature of what their 7th grade science teacher understands. And I think all of us are coming to appreciate our teachers. We're all coming to appreciate each other, I think, a little bit more. We don't see this through the lens of rural, urban. We certainly don't see it through the lens of a Republican and Democrat. I think we're all human beings, deeply capable of loving one another, meeting this moment, and beginning to love ourselves enough to recognize that it's our individual decisions that are going to determine our capacity moving forward. COVID19.ca.gov. COVID19.ca.gov is a site we put up to provide information. We'll be putting more detailed information out in the next hours and days about the exemptions to the stay-at-home order. But again, for those living in many of the Northern Californians already impacted, you're very familiar with those exemptions. And for those of you who are not, again, we're going to keep the grocery stores open. We're going to make sure that you're getting critical medical supplies. You can still take your kids outside practicing common sense and social distancing. You can still walk your dog. You can still pick up that food at one of our distribution centers, at a restaurant, at a drive-through. All of those things we will still be able to do. And to secure that, in closing, I want folks to know that we've lost a lot of volunteers that simply are concerned and understandably are staying at home. And our food banks and others that have relied on volunteers and the community spirit need a little support. And so we're going to provide that support. This shouldn't be alarming. It's humanitarian only, but we'll send out about 500 of our extraordinary leaders in the National Guard to help with the distribution and the food. Again, just purely humanitarian. And we'll be announcing some very, very exciting partnerships with social media companies like Nextdoor to provide kits, information, Q&As to, start to check in on loved ones, check in on your neighbors, things that you need, one-pagers so you know what kind of things you need at home to protect yourself. Those that are socially isolated, our seniors struggling with loneliness is much more than anything else, to make sure we reach out, maybe call 5 people a day, just check in on them. So we've got a whole kit we put out with that social media company, and we're going to be doing more with AmeriCorps and Conservation Corp in the state of California. All of this in the spirit of meeting the moment, including the spirit of reaching out those that are healthy, young, those that can make an appointment, be socially appropriate in terms of their distancing, to get a blood drawn to help those in needs. Our blood banks need support. Interestingly, we are not able to provide, because we're not doing the large blood draws and fairs, the kind of capacity we've seen in the past. The good news about the social isolation, in some respects, the need in the short term has gone down, so it shouldn't be alarming, but we want to meet the moment if indeed our blood banks need additional resources as well. So again, it's a spirit of the moment, stepping up, stepping in, recognizing our own individual capacity to meet this moment, not just relying on others, doing it safe and thoughtfully. And again, I just cannot express more appreciation for the collaborative spirit that has defined this moment across agencies, across jurisdictions, across this country, into the White House, the Pentagon, Health and Human Service agencies across this country, and sharing best practices across state, and of course the CDC and their leadership. So with that, we're here to answer any questions. I've got a team assembled behind me, and I thank all of you in the state of California for recognizing this moment and meeting it.
First question, Sophia Balog, SACB. Sophia Balog, SACB.
Part of
hospital staffing, and specifically, can you explain whether we have enough doctors and nurses and what your plans are to staff the additional medical facilities you're acquiring?
Yeah, so we've been working very collaboratively. Just yesterday, we had representatives representing the panoply of healthcare delivery system broadly defined from the hospitals on down, representatives of doctors and others, nurses clearly. We are currently looking not only at the assets within the system, but we are looking more broadly at scope of practice and reforms that are necessary under these circumstances. I'll give you a more specific example. One of the really ennobling, incredible things about our public employees in the state of California is we've been putting out a survey to those employees and asking them if they have skills in other areas and their willingness to step up and say, I happily work outside of my job description. I'm happy to lend a hand. And so we've got nurses and doctors and paramedics, all part of the California workforce in different capacities, and we're pulling them in to help supplement. Also working with our federal partners at HSS as it relates to adopting a staffing regime and strategy that can help support not just those mobile field units, but also potentially to help us with these hospitals that are coming online. I don't know if Dr. Galley, you want to amplify and fill in any blanks as it relates to additional thoughts relating to staffing.
Sure. We continue to work, just as the governor said, with our partners across the state in the healthcare professions, including working on the ratios and different things to make sure we can staff up. We're looking at individuals who've recently retired to come back and support these new facilities and existing facilities. We know that some healthcare professionals who are not as busy in their outpatient practices, nurses, doctors, nurse practitioners, other healthcare professionals can step up and are willing to join us as we build up this capacity in new facilities and increase our capacity in our existing facilities. So it has felt, and it continues to feel, like a all hands on deck mission. We're having great conversations with all of our partners across the state. The willingness is enormous. We are daily receiving emails and calls with the willingness to step up and help. We know this is going to be a challenge, but we believe Californians together are going to meet it.
Next question.
Kathleen Renane, Associated Press.
Hi, Governor. Thanks for doing this.
Thank you.
Do you have a sense of how long this statewide shelter-in-place order is going to last? And then, you talked about the state has been modeling and has been kind of seeing where this has been going for days now. Why now did you decide to issue this today? Was there a specific number or thing that changed that made you take this extra step?
No, I think we've been very fluid, as you know, on a daily basis. We've been adjusting to changing conditions, not only here in the state, but changing recognition across this country and an understanding of what's happening in other parts of the globe that require us to adjust our thinking, quite honestly, on an hourly basis, not just a daily basis. So based upon the meetings we had yesterday with our healthcare professionals, based upon the conversations we had this morning with fellow governors, with the president, CDC and others, based upon our models, based upon our trend lines, based upon some new information that came in as it relates to those models from Johns Hopkins and among others, we felt it was appropriate to raise the ante and do what we can to bend that curve. Let me remind you, the numbers we put out today assume that we're just along for the ride. We're not. We want to manipulate those numbers down. That's what this order is all about. The projection said we will have But we don't live by projection. Again, I began this by saying we are not victims of fate or circumstance. The future is something inside of us. It's our decisions that will determine those projections. And that's why we decided today to make this decision.
Hannah Wiley, Sac B. Hannah Wiley.
Hi, can you guys hear me?
Yes, thank you, Hannah.
Yeah, hi. Thanks, Governor. I appreciate you taking the time to talk with us tonight. We're hearing a lot from state workers that they're still being told to come into work, and you touched on this a bit last night, but does the state have the capability to have workers telecommute and the numbers needed for social distancing?
Yeah, that's being worked on in real time. We had a remarkable conversation last night with our largest public employees union, a teletown hall, and we talked about so many of the essential services that are provided in the state. Let me put that in perspective. When you consider police and fire and those in our corrections industry broadly defined, you're over 50% of the workforce operating on some form of 24-hour support. So it's deeply defined as essential. Those in non-essential positions that have skills are being surveyed to see if they could provide essential capacity and fill in voids that may exist or persist throughout our system. But when we look across the panoply of services, overwhelming majority of those services we believe we can meet based upon that criteria, and that criteria is being processed in real time in terms of making the actual determination to your question around how many individuals can telework, how many people don't have that kind of broadband access or otherwise are not positioned because of their particular job to get any big benefit from telework. So all of that is being processed, and we're working very collaboratively with our teams in HR to make all of that real. But it's a constant and never-ending adjustment.
Sosan Morar, Sac B.
Thank you, Governor. Has the Trump administration agreed to send the equipment you've requested, and what exactly has the federal government agreed to provide California?
Well, we're expecting the delivery of that national stockpile and those numbers that I gave you just a moment ago that the Trump administration agreed to, and they delivered. Was on the call with the president and the vice president specifically about the first tranche of those requests. They gave 25% of those requests as they're processing these requests all across the country. Will arrive, we believe, in our West Sacramento warehouse and then be distributed throughout our system. Again, that's just the first order, one of four. The other order is apparently on the way as well. And so we were very grateful to hear of that. I'm very grateful that the first assets are now about to be delivered to the state and then distributed throughout the state.
John Myers, Los Angeles Times. John Myers.
John, you there?
I'm there. Anybody hear me?
Perfectly.
Governor, can you hear me?
Perfectly.
Fantastic. One more time. I want to go back to the projection in the letter that you sent to the president of the $25.5 million, which I understand, as you've said a moment ago, is a projection if nothing else happens. At least one of my colleagues has talked to an epidemiologist at Harvard who thinks in 8 weeks that would be, in his words, a catastrophic number, and that they normally talk in terms of 18 months when you're looking at numbers like that, and that would be really bad.
Yeah.
Are you sure? I want to understand the methodology, the science behind a potential of 8 weeks and 25.5 million people.
Yeah, let me ask Dr. Galley, who's better prepared to answer that in detail.
Sure.
And Dr. Angel, who's here as well.
So in about 3 or 4 weeks ago, we began knowing that in California we had to create a model that took the best thinking from around the globe and started to look at how we would apply it in California. And using the available literature, advice from the CDC, and our understanding and experience in California, we applied a variety of different measures that looked at an attack rate, that looked at the R0, as the governor has described, which is that infectivity ratio, or that one person's infected and how many others will be infected. We looked at that time, hospitalization rates, that we had available, as well as other outcome measures. And given that, we knew that the attack rate of 56% that we chose, that was somewhat in the middle between our two, the high end and the low end of what we'd seen in the literature, would be that fairly high number, that if we did nothing across California, and it spread the way that we'd seen the spread of disease in other countries that experienced it before us, we would have a majority of our state affected by the disease. We knew that that did not equate to the same number of people who would be sick enough to seek care, sick enough to be hospitalized, and then beyond that, sick enough to need the level of ICU level care that we worry about most and some of the worst outcomes. So we built the model in collaboration with the CDC, as the governor said, to guide our planning so that we were prepared across California. And we are very glad we had built that model, because it's put us in a great position with our partners across the state to be prepared for what we are starting to see, which are hospitals with many patients and patients who are in the ICU and having outcomes that we've seen in other countries. And we feel like we are well prepared because of that planning to meet this moment and be prepared for what's coming up in the days and weeks to come.
And I deeply recognize how alarming those numbers are, and they drive headlines, but the one that matters to us is that 19,543, that 20% hospitalization rate. That's the number that guides so much of our decision making, and that we are advancing very purposely.
Bill Silburn, KCBS Radio.
Hi, Governor. Can you hear me?
Perfectly.
Oh, good. All right, Governor. First of all, I've about a million questions, but I'll only ask a couple of them. I want to go back to Kathleen's question. You didn't answer the part about how long you anticipate this actually lasting. Is there a date on this order for how long it would last? And then also, will there be any actual enforcement? And if not, how practical and impact do you think it will have, given how many people are still going out, going to stores, going to essential jobs? I think that's all you'll let me ask for now, but let's try that.
Yeah, well, we want people to go to essential jobs. We want people to deal with their essentials in a thoughtful and judicious way. But I think, and Doug, you're in San Francisco, you've seen some concentrations where we're not seeing social distancing, but you're also seeing vast majorities of that city where people are practicing social distancing without law enforcement making arrests or citing people. Social pressure is leading to social distancing, social recognition, and the socialization of this disease is leading people to change behavior on the natural. And that's, again, been socialized in 20 counties already, representing 21.3 million Californians. So expanding this statewide makes sense in that respect. And I think people are making sense of what this is and what this isn't. And again, on a regulatory bucket, we have enforcement that's not traditional law enforcement, but we have regulatory enforcement, licensing enforcement from a business perspective. And then we have social pressure that you, others, common sense will place on people. And of course, we have the capacity to move beyond that. To the extent this is a directive, it is open-ended one, and it is for a reason that we could not give you a deadline that we really could believe in. This is a dynamic situation. We could put a 2-week deadline. It gives people a false sense of what to expect. I don't expect this will be many, many months, but for the time being, we are recognizing this next 8 weeks as it relates to this virus in particular, and we want to get that curve down, and we want to meet that moment. We want these numbers to be in the dustbin of history as irrelevant to the experience that we're all about to have, and that's why it's an order without a specific deadline, but we will be very transparent with you and very forthright in the next days and weeks to update you and give you a sense of where we think and believe we are.
Jeremy White, Politico.
Governor, my colleagues have already covered the questions I had, so I'll just ask, is the entrepreneur you're working with Elon Musk?
We are working with a number of entrepreneurs, and let me just say this, I was pleased to see his tweet today.
Alexi Kosa, SF Chronicle.
Hi, Governor. I wanted to follow up on John Myers' question. I don't think it was quite fully addressed, but even with the orders to the 23 million Californians and all of the other social distancing measures so far, are you still operating under an assumption that we're on track for this 25 million Californians infected within 8 weeks, unless we all go under this stay-at-home order?
The point of the stay-at-home order is to make those numbers moot, to bend that curve. When we say bend the curve, that means the projection no longer becomes a reality because we changed our behavior. And as a consequence, that curve, that projection, that trend line becomes something very, very different in reality. And so that's what we're operating under, is that expectation. But I'm also operating under the worst case scenarios as it relates to planning and as it relates to procurement. And those two things go hand in hand. Procuring the physical assets, the human resources that are necessary. Physical assets include the hospitals, include the medical support teams, and the personal protective gear. And all of those things are being looked at through this lens, bottom up. All the numbers we just talked about are numbers in the aggregate. We don't live in the aggregate. We live in communities large and small, diverse throughout the state of California. So do our resources. And so we are working, for example, conversation I had with the Department of Defense today about looking at their resources, providing those resources in the deeper part of Northern California, in Central California, in different parts of the state, so we can make sure that we are meeting the adequacy of resources that are required. Clearly, there is a dominant focus right now in the Bay Area, particularly in Santa Clara, where we have to be overly resourced, but we have to anticipate those needs more broadly defined.
Final question, Jackie Botts, Cal Matters.
Hi, Governor. Thank you. There are more than 2 million undocumented immigrants in California, and many don't have access to health care. And certainly people who don't have access to, well, insurance or Medi-Cal might be a lot more concerned about going to the doctor to get treatment or testing or necessary medical advice about what they should be doing right now. I'm wondering what you plan to make sure that they stay safe and also that the community at large stays safe for those people who do not have access to Medi-Cal.
Well, we're a universal state. We practice pluralism, and we're a state that has universal health care. Sadly, it's in our emergency rooms. For those that are fiscally conservative, that should concern them because that universal health care costs the taxpayers a fortune. In the state of California, as you know well, we believe in universal health care. We believe in prevention. We believe in reducing costs and advancing the health of all the residents in the state of California. You're right, by some projections, 2.3 to 2.5 million Californians, by the way, have averaged being here over a decade. Many, overwhelming majority of mixed status families, very impacted by the public charge rules, very impacted by the anxiety of this moment. I hope ultimately they'll give up on public. Those that are receiving public benefits that are in the process of making a determination around their status for permanent residency or otherwise, they are not going to be impacted by being recipients. And we need to remind people that. We need to socialize that across the state. We're also going to be doing a series of PSAs that meet people where they are and remind people of the things we already have done. We have universal health care regardless of immigration status that we expanded last year up to the age of 26. And clearly, as you know from my budget, we had a desire to do even more. To the extent we can, we are reviewing that. We're looking at the entire budget, looking at the existing proposals that we introduced in January, looking at where the legislature is currently in terms of whether or not they'd support it. But the magnitude of the economic impacts and the costs broadly have obviously put a reminder that we have to contextualize all of the needs together. And that was the importance of the call of Speaker Pelosi today, and incredible and imperative to have federal government support, particularly in one area, and that's unemployment insurance. There's no greater impact quickly in terms of unemployment insurance. And as you've seen, those claims have skyrocketed in the state of California, 40,000 a few days ago, 70,000 2 days ago, 80,000 claims yesterday. New numbers will be providing you very shortly from yesterday. It gives you a sense of the magnitude of this moment, but we'll meet it for all our diverse communities. Let me just conclusion, since that was the last question, make this point as well. I'm very proud to be a Bay Area kid, born and raised, but one of the things that doesn't make me proud is part of our past. I come from a community that initiated the Chinese Exclusion Act. I remember a guy by the name of Dennis in the time, and he began and ended every speech by saying, whatever else we do, the Chinese must go. That yellow fever led to the Chinese Exclusion Act. It's a real black eye in the history of the United States of America, our state, my city. One thing I also want to express is deep, deep recognition of the xenophobia and the racism that is being perpetuated against Asians in our state. We have seen a huge increase in people that are assaulting people on the basis of how they were born, the way they look. And I just want folks to know we are better than that. We are watching that. We're going to begin to enforce that more aggressively. And I just hope people put down their bigotry, their bias, and recognize in a state where 27% of us are foreign born, a state that, as I said, is truly universal, the most diverse state in the world's most diverse democracy, that in order to meet this moment, we have to recognize our common humanity. And so it's in that spirit I conclude, and I thank all my fellow Californians for recognizing the urgency of tonight's call. And over the course of the next few days, we look forward to working very closely with everybody so everyone understands where we are and where we're going as a state and as a nation. Good night, everybody.